This opportunity to present. We are looking at procedures we've done the last 6 years. Next. And it was a retrospective study. We are looking at 2008 to 2013, and we are trying to establish viability of laser lithotripsy in a day surgery setup. We had a total of 156 patients. Next. The procedures were mainly done by 3 surgeons. Professor Mungai did 110, Dr. Maina Kani 41, and Dr. Waweru SMK 5. The mean age was about 40 years, and the lowest age was 9, and the highest 75 years. We had more male than female, 114 in the 6 years and 42 females. It was just interesting that we had many patients who are of the Somali origin. That's why I looked at the ethnicity to find if there's anything in the epidemiology. We had 84 patients of Somali origin, and other Kenyans were 72. The patients who were done stenting were 80, that's about 51.3%, and 76 patients were not stented. Stone clearance was 95.4% on all the patients who were done. And generally, all patients were given antibiotics and a non-steroidal anti-inflammatory. We had 2 patients who had infection and given antibiotics after that. Urethroscopy was only done in surgeries that were very bloody. And there's the issue of stent pain, where the surgeons reduce the length of the stent left in the bladder to reduce stent pain for the patients. And looking at literature, outpatient laser lithotripsy has been considered safe in other studies. There was a study that revealed that you have more male than female patients, but a 2007 study also showed an increase in female patients, which could be due to lifestyle changes. Because from the epidemiology of stones, of patients with stones, we find that most of them are due to diet. Stenting has been, in literature, stenting has been recommended in complicated cases. 47%, we saw that ours had about 50% of them were stented. Lower urinary tract symptoms are common in stented patients again. And ethnicity may not necessarily be related to higher incidence, but more related to diet. And stone clearance in literature, we've seen 92.6%. Our study had about 95%. I also looked at the role of nurses in taking care of patients undergoing laser lithotripsy. They must be dedicated, interested, and committed, because most of the time is the surgeon performing. The surgery could be long, and if you're not interested and committed, then you are not useful. They should also be gentle and organized because of how delicate the instruments are. They should be knowledgeable and continuously training themselves, and be cost conscious. The fibers are expensive and the instruments are delicate. If they're not well handled, then it can get very expensive. At the point of admission, ensure patient is suitable for day surgery. Their nil by mouth status and the comorbidities are less. Ensure they have their x-rays and psychological preparation of the patient, vital observations, and glycemic state for diabetic patients. Establish anatomical variations because of the position in lithotomy. Ensure that the patient will have adult support when they are going home because they are day surgery, and participate in patient positioning to ensure a patient is handled safely, especially where you have hip and knee replacements or injuries. Preparing the instruments, you need the urethroscope, laser fibers, the stent, image intensifier, lead gowns, instrument sleeve, light source, cable, camera, and video recording system. You also need to handle the instruments well. We currently use high-level disinfection and soak the instruments for the recommended period. Rinse instruments well after cold sterilization, but saline should not be used because they can damage the scopes. And also flush the instruments well. Ensure warm irrigation fluids are available because they use a lot of normal saline, and that can lead to hypothermia. Have adequate drapes. to ensure sterility because of reduced risk of infection, and stay alert throughout the procedure. When the patient is positioned back safely, kept dry because they could be wet because of the fluids. Separate camera cable. Many times it's forgotten. We ensure that it's decontaminated, and soak the other instruments to decontaminate safely. Immediate recovery observations and pain management is important. Transferring to second recovery as per protocol. Patients ask many questions. How was the surgery? Has the stone been cleared? And those are the questions we need to answer tactfully, because you may not have the stone to show the patient, and they want to see the stone, and then we discharge the patient safely with the treatment, antibiotic, analgesics, and postoperative instructions. And in conclusion, uretroscopy and distal lithotripsy can be done safely, and prospective studies are recommended. I hope we'll be able to do that, so that we're able to look at the level of the stone. In these cases, we were not able to tell whether they were distal or proximal or mid-third of the ureter, so that we're able to analyze the stones and also monitor the patients for a longer period. Thank you.